Doctors at Seattle Children's Hospital are harnessing the power of the immune system to try to combat cancer. Now they're using that same immunotherapy to try to target other diseases like HIV and type 1 diabetes. Jim Dever takes a look.
Dr. David Rawlings developed a personal interest in the immune system in his 20s when he was headmaster at a Kenyan high school. His students were often absent due to malaria. Rawlings even got the disease himself.
And I got malaria, I think 4 times total.
Today, he directs the Center for Immunity and Immunotherapies at Seattle Children's Research Institute, studying the healing system most of us were born with.
And I think that's the beauty of the immune system, is it's a balancing act. And if you understand what pushes it out of balance, you can push it back into balance. And that's what we've learned to do with some drugs, and that's what we're trying to do now with cell therapies.
With this cutting-edge cell therapy research, he hopes to cure diseases by editing a patient's genes, making them behave in a way that resists illness on a cellular level.
The next frontier beyond that is really, can you make a living drug, which is a cell-based therapy that is using the immune system to do something helpful for the patient?
Children's has already used immunotherapy to stop cancer. Milton Wright battled leukemia 3 times and is the second patient at Children's to become cancer-free after going through this experimental treatment. But Children's researchers want to take this innovation even further.
Now we're trying to move from cancer immunotherapy to other immunotherapies, and the one that we're most excited about is, can we use these cell therapies to treat autoimmune type of conditions? And that could be a whole range of things.
Immunotherapy, or cell editing, could help battle autoimmune diseases like HIV and type 1 diabetes. Here's how it works. Patient stem cells are removed in the hospital. In the lab, the gene is edited with tools developed at Seattle Children's. The faulty gene sequence is repaired. Stem cells with the repaired or edited gene multiply. Then the edited stem cells are returned to the patient in the hospital.
Now we're kind of building little therapeutic engines that we can kind of give to people, which are cell therapies. And these are like living therapies. So one of the advantages is, if they do what we want them to do, they also continue to do it. We don't have to keep giving a drug over and over again.
Right now, researchers are developing preclinical data for human trials, which the doctor estimates will take place in 3 to 5 years.
It's critically important that it's also safe when we do this.
And this type of editing may change the big picture for treating disease.
This type of treatment is going to work for lots of different immune diseases, we think.